Doctors of Reddit. What was the worst thing you've seen for a patient that another doctor overlooked? During my residency we had this lady in her 60s who was getting progressively more forgetful. Just overall declining and getting less and less able to take care of herself. She had been seeing her PCP who diagnosed her with dementia. And she saw a neurologist who agreed. She was not really able to provide an accurate history. After talking to her family and friends, it became apparent that her symptoms were progressing unusually quickly. I remember seeing the point where her new hair growth met her bright red dye and also her grown out nails with hot pink polish, thinking, wow. It really wasn't too long ago that she was not only taking care of herself but like going to get her hair and nails done. The lady in front of me was so far from that. The neurologist I was training with recognized this. Had her admitted and did every test including lumbar puncture. Workup eventually showed Creutzfeldt-Jakob disease, mad cow, which there is unfortunately no treatment for. She died a few months later, but at least we were able to prepare her family that she would only continue to decline so they could make arrangements. Really sad situation. Rattlesnake bite. On a 2-year-old. Patient and dad out in the fields near a small town that is several hours away from the nearest big city. Where I work. Dad takes the child to the ER in the small town with an obvious snake bite. Doctor there says hey, it's okay, she probably didn't get envenomated. Doesn't give the patient antivenom. Which they had at that hospital. And instead of electing to send the child to us by helicopter, he sent her by ambulance. Several hours later patient shows up to our hospital coding. And ended up dying. Probably didn't get envenomated? Question mark? What the frick kind of stupid ass idea is that? If a tiny child gets bitten by a rattlesnake, you assume they've been envenomated and you treat them as though that had been. That means antivenom, physiological support, etc. Completely absurd. He put the pacemaker lead in the subclavian artery and across the aortic valve into the left ventricle. The proper approach is subclavian vein to right ventricle. And then he didn't notice it for over a year. I saw the patient, a 25-year woman who didn't need the pacemaker in the first place, when she was in congestive heart failure because the pacemaker lead had destroyed the valve. A surgeon and I had to do surgery to remove the pacemaker and lead. Then replace the aortic valve, totally inexcusable. Well, 50% of doctors are below average. But everybody thinks theirs is in the top 10%. Neurologist sent patient to our ED without informing her that imaging showed a glioblastoma, assuring her impending death. He didn't overlook the disease. He overlooked the communication. I'm not a doctor, but a RN. This happened to me, but isn't nearly as bad as most of the stories on here. When I was in college, I got to where I couldn't swallow. It started with difficulty swallowing. Progressed to me having to swallow bites of food multiple times, regurgitating it. And then got to where all I could swallow was broths and mashed potatoes with no chunks. I went to the doctor multiple times. And was told every time it was acid reflux and part of my anxiety disorder. I lost 30 pounds, was only 120 when this started, and was just generally miserable. Finally my grandma was tired of watching me be sick all the time. So she called the GI doctor herself. They said we needed a referral. But she explained the situation and they got me in the next day. Did an endoscopy and my esophagus was 95% occluded at the gastroesophageal sphincter. For some reason. Some of my primary doctor's notes ended up in my discharge paperwork. I guess they had to contact her to get my information, and she had told them it was acid reflux and basically I was being overdramatic. She stated she did not recommend them to do the procedure. Needless to say, I switched doctors. Frick that bitch. Was not a fun year. Not a doctor. But for years I've had migraines. They were mainly behind my eyes. But I chalked it up to stress and hormones. So did the neurologist I went to see for them. She seemed annoyed that I kept saying the pain is behind my eyes. in my temples and the pressure was insane. She gave me Imitrex and sent me on my way. I went to visit my eye doctor for a checkup and she did the exam and asked if I'd get headaches. I told her yes. But it seems like I always had one. She told me my optic nerves were very inflamed and excess spinal fluid or a tumor can be the cause. She sent me to a neuro-ophthalmologist where I had a brain MRI, a spinal tap and new medication to help keep my spinal fluid in check. The neuro-ophthalmologist said I was about 6 months away from vision loss. That I was lucky I mentioned my headaches to my eye doctor. After the spinal tap, they took out about 100 ccs of fluid and measured the pressure at 42. When normal spinal pressure is 8-16. Big middle finger to the neuro who shoved drugs at me. MD here. Recently was called over by a nurse who told me a patient's bandages were wet as they were bleeding a little. Patient had recently had his leg amputated. We pulled his bandages off and found a spurting femoral artery. At this point the patient passed out. Patient was sent to theaters for an emergency operation. Close call for sure. I'm an emergency medicine physician. I think the biggest miss I caught was a STEMI. I took Sign out from the previous doctor. Then I usually go through every patient's labs, imaging, and EKG. Found an EKG that showed a massive heart attack that was done about 8 hours prior. By the time I took over the patient no longer had pain. The new EKG that I got was more normal. And the cardiologist didn't take him to the cath lab. Here's my story. A guy came into our ICU and was very septic but still talking. He had visited his primary care MD with complaints of a sore throat for a couple of days. Dismissed without any intervention since he didn't appear to have strep throat or the flu. At this point he was having pretty severe abdominal discomfort. So we sent him for a CT scan. As the scan was finishing, he coded and had to be intubated. Multi-organ failure, etc. The CT scan was horrible. He had all kinds of poop all over his peritoneal cavity. His wife told us that he had choked on an ice cube the day before he saw his primary care MD. Evidently he swallowed a whole double half moon shaped ice cube that perforated his esophagus with a huge linear 4.25-inch tear, allowing a significant portion of his swallowed food and drinks to get into his peritoneal cavity instead of his stomach. To make things worse, he had some reflux that allowed stomach acid to get in there as well, likely while he was sleeping. Once we realized what was going on, he went for extensive washout and exploratory surgeries to repair the damage to his esophagus and other organs. Thankfully, he made a full recovery, but he was very close to not making it. I found an obvious huge rectal cancer on a patient who was previously told over and over again that she had hemorrhoids. In residency I saw a cardiologist miss a STEMI, heart attack. By the time the patient came to us, some of the muscles supporting one of his heart valves had completely died and he was in cardiogenic shock. Basically his heart function was so bad that it wasn't circulating the blood in his body enough to support life. It was awful. Happily he made it through though. Once when I was a medical student on surgery rotation in trauma, we had a patient come in after he fell on the street and bonked his head. Well, apparently he had fallen once earlier that day and was discharged when the trauma workup at the other hospital was negative for injuries. We examined him and noticed his eyes were kinda yellow. So as part of our trauma workup, given that he couldn't give a great story and we couldn't be sure what happened, we CT scanned his abdomen and saw his common bile duct was like 3 times normal size. Could drive a truck through it. About that time. Next set of vitals, his temp was 103 F. Guy was floridly septic from ascending cholangitis, which is why he was falling down. Big miss, and that is an emergency. Young student from, I think, Pakistan. He was complaining about his neck feeling stiff. He went to a doctor some days before and he was told he was having joint pains that would pass with some common anti-inflammatory drugs. When I visited him I saw many of the lymph nodes in his neck were swollen, which probably caused the stiffness. And not painful, not a good sign. Sent him right away to have a chest x-ray that showed a huge mediastinical mass. Suggestive of lymphoma. Sadly, I don't know what happened to him. I've got a good one, albeit sad. I was working nights and a patient came in for an AL bed repair under general anesthesia. It was a slow night. As they are anesthetizing him, he aspirates, so we do a chest x-ray to see if he's got any spit blood in his lungs. What we didn't know is that prior to this emergency surgery, he'd been going to his GP for over 6 months complaining about chest tightness. They'd put him on various different asthma medications, but none had any effect on him. The x-ray showed a massive dark mass in his left lung. We kept him asleep and transferred him to ICU. His wife and 3-year-old daughter were waiting for him on the ward. We had to tell them where he'd gone, why he'd gone there, and what was going to happen. He died from lung cancer within the month. Edit. A general anesthetic is absolutely ridiculous for an AL bed repair, but he refused to have it done under local. A commenter below rightfully corrected me. And after talking with a colleague, the dark space in his lungs was the normal lung, and the rest was whited out because they were riddled with tumors. This man was in his late 20s, a non-smoker, and I couldn't move past the situation for months after it. AIDS. As in, the patient had no working white cells whatsoever. It all started with what appeared to be a fungal infection in the chest, but after many pulses with the triconazole, the plaque was still present and growing. So the physician called me to check the patient, and the chest plaque was indeed very suggestive for a fungal infection. The direct examination even confirmed the existence of the fungus, but the treatments were doing nothing. So I rechecked the file, and lo and behold, the leukocytes count was quite low. A quick HIV test later and the patient was diagnosed with AIDS on top of its body fungus. To the credit of the physician that called me, the patient lied on the clinical exam as he marked he had no active hanky-panky life. But when confronted with the evidence, he spilled the beans. Turns out he was a regular with the local hookers, but also quite active in online dating. Public health wasn't happy, to say the least. I work in EMS. We got a call for a female with leg pain. When we arrive on scene, this woman's leg is 3 times the size of her other one. Blue and purple. And she has no pulse in her foot. She fell on ice a few days prior and the urgent care didn't do any x-rays. Told her she had a sprain and gave her a walking boot. In reality, her tibia and fibula were both so badly fractured they were cutting the blood vessels and muscle tissue. She lost her foot. I have a story in the opposite direction. A woman came into the ED for extreme fatigue and spontaneous bruising. They checked labs and saw low white blood cells, red cells, and platelets. They told her she has leukemia and will need chemo. Without actually doing any confirmatory tests, they admit her to my service. She is crying and screaming in fear. Get more history and find out she was just started on a medication for her rheumatoid arthritis that can cause decreased blood and platelet cell counts as a side effect. Did some further workup and found no evidence of leukemia. Stopped the new medication and within a week she was completely back to normal. One that comes to mind is when I was a resident. The ED doctor wanted to admit a mild septic patient with a UT. I review her labs, and knowing that she is a diabetic, it was obvious flora DKA, diabetic ketoacidosis. That kind of admission typically goes straight to the ICU to get insulin via a drip and aggressive IV fluid rehydration. She was just in the ED hallway with no medications at all, looking like crap. I'm not a doctor, I'm a nurse. But not in med-surg. My sister had her gallbladder out. Routine surgery. And 2 days later woke up at 4 AM in searing pain. Went to the ER by ambulance. I met her there. The ER docs were all apparently convinced she was a drug seeker and did not even conduct a physical exam beyond taking her vitals. They snowed her to shut her up because she was just yelling, "Help me. Help me. I'm dying." They did eventually do an MRI but said it was negative and sent her home. She didn't want to leave. Insisted something was terribly wrong. but they said they would call security and have her thrown out. At this point I'd like to mention that she had no history of drug or alcohol abuse. She continued to get worse at home and the next day went to a different hospital. They did a workup and found that the metal clip that closed off the bile duct had cut right through the tissue and she had a large bile leak that was literally burning all her abdominal organs. She had to have 3 surgeries to fix it and was hospitalized for 9 days. Left with chronic pain from adhesions and chemical burns. When the new hospital finally acquired the MRI from the original ER visit, she was told that the leak was small but clearly visible in that image.
Hi there. Look, if you enjoyed the video, well, why not go ahead and hit that like and subscribe to Reddit Stories. In fact, if you want to see even more responses to this thread, well then, take a look. There's the link in the description below. And remember, show some love to those authors while you're there. And I look forward to seeing you next time.